struggled to meet some of their key targets. Figures in September show 95% of patients weren't seen in A&E within 4 hours. And the number of people who were delayed while waiting to be discharged from hospital was at its highest level since first recorded in 2010. Our health correspondent is Adam Brimley.
This is the situation for September. It doesn't necessarily tell us what's going on now. It's probably helpful that we've still got mild weather across most of the UK at the moment. But a lot of trusts clearly are operating on the edge of what they can manage. Many of them are overspending in order just to keep the situation as it is. And it could be if we see additional disruption brought about as a result of industrial action by junior doctors. That's likely to happen in December as things stand. That could be something that really pushes services in some places over the edge. It could be very worrying, very disruptive.
Dr. Johnny Marshall is a GP and the Director of Policy at the NHS Confederation, which represents over 500 NHS organisations across England. Thank you for being with us. Are you worried about these figures?
Well, behind all of these figures is a very human story about people being in hospital when it would be more appropriate and they'd much prefer to be at home. So that has to be a good thing for us to be striving to achieve. And the reason for it is that the community services, the social care services that are so important at allowing people to be discharged home and kept safely at home are just so stretched they don't have the capacity to support this early discharge.
So there are some key targets missed here. More than 5,000 people have delayed transfer of care. What's causing these problems?
Well, that's been caused by the fact that we don't have the sufficient capacity in the community services and social care services to be able to support people at home or in care homes so they can be discharged when they're ready to come home. And what we need to do about this is look at the importance of the healthcare and the social care budget together in providing the right services so people get care in the right place.
Yeah, I guess that doesn't really tackle the A&E issue, though, does it?
It doesn't tackle the A&E issue, but I think the experience of both our members, the experience of the patients that they see, that I see, I guess, on a weekly basis, is the most important thing. Is getting people the support at home in the right place. And we've written to the Chancellor saying, look, with the comprehensive spending review you're announcing at the end of November, it's really important you look at the social care budget and the healthcare budget together. Otherwise, more people are going to end up being cared for in the wrong place.
These are figures that you might expect to see in the midst of a tough winter, though, Johnny, rather than late summer, early autumn, and a mild one at that. Are you concerned about what's to come?
Well, the pressure on the NHS has been growing year on year, and what was previously described as a winter effect, you're right, is now becoming much more common all year round. What our members are doing is they're working with social care partners to try and develop new care models that help to manage the increasing demand as we have an older population. So we can really try and make sure, I guess coming back to your first question, it's really important that we're providing the right services for people where they want to be looked after, and we need to continue to develop those new models across health and social care to do that.
OK, thanks for talking to us. Dr. Johnny Marshall, who's a GP and the Director of Policy at the NHS Confederation.